Good afternoon, everyone, and thank you so much for joining us. My name is Betsy Minnick, and I work with PolicyMap, and I am here with my colleagues at PolicyMap, Trudy Thomas and, and Eliza Wallace.
Hello.
Eliza Wallace is here with me in Philadelphia. She's our data development lead, and she joined us this year. And Eliza, can you just introduce yourself and explain a little bit about your background?
Sure. I just joined PolicyMap a few months ago. My background previously was as a GIS analyst, doing analysis for a regional planning agency. So my background is in urban planning, policy related to that. And so now that I'm here at PolicyMap, I work with a team to keep our data up to date, to load new data when it becomes available, and to develop some of our own data sets in-house.
Great, thank you so much. I wanted you all to know that you are in listen-only mode, but you do have the ability to ask questions, and Judy and I will be looking at those questions and trying to respond to each and every one of them. Really, there is a wealth of data related to health that's available through PolicyMap. So we just want to show you a few examples and really whet your appetite for what's there and what we have access to. Now, if we take a quick look, our main topic is using this data to visualize community health. And if you take a look at this illustration, it's a great illustration of how zip code is a great predictor of health. And this is from a presentation that was given by Dr. Melody Goodman at Harvard. She's from Washington University in St. Louis, and she shows the Del Mar Divide. And along Del Mar Boulevard in St. Louis, you can see the disparity simply through one line of traffic, or one line on the road. So home values, and income levels and education levels, and even just the demographic makeup really shows what's happening. And the truth is that the residents to the north in this picture are less likely to have a bachelor's degree and more likely to have heart disease or cancer. So, not sure why I'm having. I also hope that you are on our email list and you've got our brand new Hot Off the Presses newsletter today. This newsletter includes a white paper that was written by PolicyMap President Maggie McCullough, and it really goes over a lot of the same points that we hope to illustrate today. Lots of good samples and lots of good background, and even better yet, there's lots of great references on the final page. As librarians, we're really excited to have more and more references and data that cite exactly what we're going to talk about. And in addition, we're going to, if we have time in the end, talk about our community health report. It was launched in April of this year, and right now it is countywide dynamic report that is going to show you a lot of the factors needed for a community health report. The important thing for you to know about this is that we worked with experts in the field, and with their suggestions decided on which data needed to be included. It's really an interesting report, a great report, and we've been told that it puts together in one single place a lot of the data that it's needed to create a community health report. So there are lots of data indicators that allow us to determine, or that are social determinants of health. And we're going to go through some of these main categories that we see on PolicyMap, starting with demographic data, data related to incomes and spending, housing, quality of life, education, and health. And in the effort of keeping this interesting, I'd like to keep it live, and I'm going to show you exactly what there is on PolicyMap and how you can locate that. So, number one, I wanted to, first of all, show you some of the data that's here and the indicators and sources. PolicyMap is a product that was developed by Reinvestment Fund. And Reinvestment Fund is a community development financial institution. And it's a leader in social and economic research and philanthropy. And the data that was collected here is really just data that we needed to look at on a map to find hotspots, to find areas of investment. So we have a data team here in Philadelphia that's constantly updating, curating, cleaning this data. And as you link through the categories on the right-hand side, you'll see that there's data related to incomes and spending, and housing, lending activity, and health. We do aim to be extremely transparent about this data, and this matrix here will tell you how granular the data is, exactly where it's coming from, how frequently it's updated, and how far back it goes. So it's really a great place for you to start if you're wondering if we have a specific data indicator or data point. So I just wanted to show you that this is all linked and you can get into that fairly easily. And additionally, we have all sorts of support and blogs and regular training. But let's go ahead and let's open up our map and get started. So, when we're taking a look at PolicyMap, the first thing I want you to be aware of is that the categories I was talking about that are related to, let me reset my map and make it brand new. The first thing that we were talking about that was related to health was demographic data. So here within our demographic data, we'll have data related to race, ethnicity, information about languages spoken, information about foreign-born population, people with disabilities. So if you're looking for information by age group, by employment status, by poverty status, and even hearing and vision difficulties, you can simply click on any one of these data layers and display it on a map. When you're looking at the map, we have a location toolbar. And from here, you'll see that anytime you do a search on PolicyMap, that you are doing it for the entire United States, but you can zero in down to, in many cases, down to the block group or census tract. You can also just simply enter in a specific address and pull that up simply and easily. So here I'm able to pull up those areas in Philadelphia and see the exact percentage of people with hearing difficulty. From here, I can look at different percent number, and in some cases, I can look at changes over time. So this demographic data is here. There's data related to homeless, sheltered and unsheltered. Very simple and easy to see what's there. There's even a diversity index that will show you predominant race or ethnicity. So the demographic data is great, and you'll notice as we go through how to create a map, there are also other categories. We'll talk about incomes and spending. And when we talk about incomes and spending, you'll see that there's data related to people in poverty by race or ethnicity, families in poverty, families with single-headed families with children, and families in deep poverty. And here, I can zoom in and zoom out. Maybe I wanted to take a look at, we'll take a look at Tampa, Florida. Any area on a map, then I can zoom in. And again, I can take a look at percent or number and pull that out as well. There's going to be information about the Gini index of inequality. And from within here, let's take a look at this. We can look at Dayton, Ohio. And as I look at this, again, I can drag this map around. I can zoom in and see exactly what's there. And as I look at things related to incomes and spending, realize that some of the factors that predict your health are not just the health factors, but they are factors related to incomes and spending, and what you make, and how much you earn and how much stress you have, information about your home and what you have access to from your home. So here, if we take a look at this area around Dayton, I can click on here, and I pulled up this one area within Dayton that 70% of the people of the households in this census tract are making less than $25,000. At PolicyMap, we try to be extremely transparent and give good definitions of exactly what the data is. So you'll notice that I've clicked on the title, and this title will actually give me the exact definition of what exactly the Gini index measures. So it's a way for you to go in and see exactly what's happening down to the block level, or zoom out and look at it on a county or state level as well. Let me go back to our PowerPoint, and we're going to talk a little bit about how with PolicyMap you can simply log in and go through each one of these categories and see exactly what's there. But the other piece that you need to know is that we have this great little find button up here. So if I was looking for information related to poverty, I can simply type that in, and it's going to give me a list of data layers or data points that are related to poverty. So if I'm looking for the estimated people of 65 who are 65 or older living in poverty, I can simply and easily use this find button as well as navigate directly through these categories or menus that are here. So we wanted to talk a little bit about mapping poverty and seeing exactly what's there. We've talked already about persistent poverty tracks. You can also isolate what the minimum wage is by state. And more importantly, and more topical for our webinar today, is finding medically underserved areas. So here is a sample map of the area, again, around Dayton, Ohio. And I would prefer to go live, so I'm going to go ahead and I want to look for persistent poverty. And we're going to go ahead and pull that out. Oops, that's the wrong one. Sorry, guys. That's the joy of going live, though, I guess. And from here, I also wanted to take a look at these tracts that are considered persistent poverty tracts. And again, I can link to this title, and it will tell me exactly where this data is coming from. In this case, it's being provided by Brown University's longitudinal tract database. Here, I can now take a look at some of the points related to health in this area around Dayton. And maybe I wanted to take a look at community health centers and lookalikes. And I can see what's available there as far as community health centers. I can also filter this data. I can filter it by the type of healthcare center it is. I can also filter by operating hours. And any one of those points I can click on, and I get all of this data that can be downloaded for my own use. So here's information about the community health centers of Greater Dayton, all sorts of information. And as I mentioned, you can download this data. So if I wanted to, oops, I'm sorry, I can create a region. I can assemble a region or do a radius or draw a region. And from here, I can go through, click, oops. And then I'm just going to call this my area of analysis, save that, and now I can pull down a list of the health centers and lookalikes for that area that I drew around Dayton, with all of the underlying data that I showed you before when we clicked on every single one of those points. So just a really simple and easy way to get to the data that you're looking for. And really, the one thing I should have mentioned from the very beginning is that PolicyMap was really born as a tool for the non-GIS expert. So it was a way for people who didn't want to take a class that went through complicated software, for a whole semester, and to be able to go in and immediately visualize what was happening in their community. So really that was really the whole point of PolicyMap. Okay, so let's stay on track, and I'm going to go back and talk about some of the other things that we can take a look at. I've already talked about the Gini index. Now let's talk about housing. And some of the social factors that relate directly to health have to do with home vacancies, the affordability of your home, gentrification, and even housing quality. So one of the things that PolicyMap is especially strong is housing data. And I'm going to call on Eliza in a second just to talk a little bit about that. But we recently announced that we'll be updating our housing data with data from Zillow. But one of the things that you'll want to take a look at when you're thinking about the social factors that influence health are going to be things about housing burdens. So what are the median rents like? The housing quality. Information about whether or not the housing has plumbing facilities or kitchen facilities. If I click on plumbing facilities, I can figure out exactly where there are homes without plumbing facilities. If I want to take a look at Lexington, Kentucky, I can zero in here and pull that out down to the census tract level. See exactly what those figures are. So certainly that affects the quality of the home. The other piece is the age of the home. The homes that were built pre-1980 are more likely to have lead-based paints. And this, especially in urban areas, is going to be a huge factor. So if I go into maybe Atlanta, whoops, I need to know how to spell Atlanta correctly, of course. Here we go. And at this point, I can figure out which neighborhoods are potentially going to have older homes and a higher risk. In this case, I've pulled out a tract that is 90% of the homes were built before 1979. So it just gives you an idea. And we're really just looking at very simple maps right now, but you can also create 3-layer maps, and I'll talk about that in a little bit. And we could actually take a look at poverty rates and the age of the home and the individuals who are living within that neighborhood too. So keep that in mind. Okay, so cost burdens, of course, will always be of concern. And here we have a map that shows the area around the University of Mississippi, and 57% or more of the people within this dark purple area are renters who are burdened. Certainly affects your health if you're worried about paying your rent, and then maybe you don't have the money for your health care costs. So something to keep in mind. And this is just an illustration that's actually showing that older homes are more likely to contain lead-based paints. And those before 1940, in fact, will be the highest threat. Okay, so we talked a little bit about home age. Let's talk a little bit about education. And the reason I'm sort of going through this relatively quickly is that I want to get to the wealth of health information that's here as well. So when we take a look at some of the education data that's here on PolicyMap, you'll notice that there are data layers and there are also data points. And that was true when we were looking at housing, lending, and we'll look at quality of life as well. But let's talk a little bit about educational attainment and how that affects your health. I'm going to go in and show you some of the information that's here. There's enrollment, there's educational attainment. Maybe I'm looking at those areas where there is less than a 9th grade education, or high school diploma, or just some high school. And if I ever have a question about exactly how that data is collected, this is actually high school but no diploma. Here I can take a look, and I'll choose another city. Let's take a look at San Diego. Oops, I'm sorry. And if I zoom in, I can find those areas Here it's 12%, 17% if I keep on zooming in. And then I can also take a look at school performance. And again, I can filter this data. And I can color code this. This is Great Schools data, which is licensed PolicyMap, and it's for subscribers only. But from within here, I can see what schools are here and how they're rated. The reds and the oranges, not so great schools. The blue schools, they're not in that area of Escondido. So if I click on this, I get lots of data. Where the school district is, what the rating is, grade scores, or the scores, lots of really good information. Not only is there school performance data, there's also data on public and private schools. If I'm going to take a look at, I can take a look at enrollments and demographics, and again, I can filter this data. And I can see which schools offer free or reduced price lunches, which ones are Title I eligible. So, you know, here from the health perspective, we'll definitely want to take a look at which schools are offering free and reduced price lunches. And we get the idea. So, when you're looking at PolicyMap, keep in mind that you can print your data and download your data, and you can share your data. So I just wanted to show you that we do have a really greatly enhanced print feature that will allow you to go in and create a beautiful PDF or PNG document that you can import into schoolwork, you can import into PowerPoint presentations, and just keep in mind that it creates a really nice high quality image. You can also download this data for use in other sources. You can download layers and points, and you can download your points with layer data together. So if I wanted to do that, I can do this, and I can also do it. Maybe I just wanted to do it for all of California. And then I can download this data on the estimated percent of people with some high school and no diploma, and it's also going to give me all of those schools within there. And I can filter out those schools as well by free and reduced price lunches as well. So I'm trying to show you some of the functionality that's here as well, just so you get the idea that there are some definite easy ways to use this data, not only within PolicyMap, but within other sources as well. Additionally, you can easily share our data. So you can link to this, you can email the data, you can embed it, and you can even, post it to your Twitter feed or your LinkedIn profile. So there's some really neat points here. And you can save your data. And those of you who are university subscribers should know that when you log in, you can create your own personal email account so that you can save your own data. That would be stored over here on the far left-hand side under the My Data tab. Okay. So we've talked a little bit about educational attainment. This is a great map for the area around, let me see, I can't even see. It looks like Newport Beach. And we're finding this Dinwiddie County Public Schools, the area, the graduation rate is 70%. And that's a great difference for the areas, over here, Newport News. So keep in mind that you can quickly and easily visualize information related to educational attainment. Here's a great map, and I want to actually do this one live because it's going to show you school-age children in poverty, but I want to show you how you can play with our maps. And again, I'm going to reset this. And let's take a look at this. So as we go through here, you're going to see there's information about student population, students in poverty, free and reduced lunch again. If I click on students in poverty, I can get a really good map of the whole United States and find some areas of interest. If I just wanted to take a look at Jackson, Mississippi, you can do this down to the county or city level. What I want to do is show you that our subscribers have the ability to play with these ranges and view things differently. So if you really wanted to see those areas where There 50% of the children are school-age children in poverty. It really pulls it out and shows you quite a striking map. So if I just do this for the whole state of Mississippi, it pulls it out, again, it shows me these areas where there's a large number of school children living in poverty. So keep that in mind, that you do have the ability to play with this. You can even change your colors if you want. You can make it blue if you like it blue. And we are compliant as well, so we do have black and white maps as well. So, okay. Reading proficiency is another area of concern, and also access to services. So one of the things I wanted to show you is that, and I actually had the pleasure of showing one of our university subscribers this, and that is you have the ability to take a look and see where nonprofit locations are. And if you're like me and you're a library geek, you can see where your libraries are. You can see your library hours, or you can see what type of an outlet it is. Simply and easily map that data and pull it out and see where kids who are not necessarily reading proficient, or actually the white areas are where they're less reading proficient, have less access to libraries. You can also take a look at, the nonprofit data. Again, if you wanted to figure out where it was, let me see where I can go to nonprofits, and you can pull up that as well. And again, you can filter this data, and there you're going to be able to find nonprofits related to medical research, nonprofits related to mental health and crisis intervention, housing and shelter, youth development. So here, education, this gives you an idea, exactly where nonprofits are located within these areas. Okay. So this is another area of strength, especially for PolicyMap, and that is food information, and information about access to healthy food, identifying food deserts. And what we'll do is go through some of the data sets that are here available within PolicyMap. Hopefully you were aware of the fact that we recently loaded the limited supermarket access data from Reinvestment Fund. And there's more information about this and how it was collected through our blog. So if you don't subscribe to our blog, I highly recommend that you do. If you go in here and you want to take a look at data related to quality of life, this is where you're going to find a ton of very important information related to public health and factors related to health. So there's data related to crime, to access to technology, broadband internet access to transit, so that you have the ability to get to your jobs, you have your ability to get to your health care. Information related to food and healthy food access. So we have a couple of sample maps that I created before. Actually, I'm going to go in here and show you directly what's here. Let's take a look at some of this limited supermarket access data. And let's go into Chicago. And for this area, again, we can pull this out, see exactly what's there. Again, you can go in here and see exactly how this data is collected, where it's collected, and how it was determined that the status of this area is limited supermarket access. So it's defined as the percent by which a block group's distance is to the supermarket, and also information about how easily someone can travel to the nearest supermarket. So if I pull in here, I can take a look and see what's there. We're looking at these data layers. But there's also all these great data points. There are grocery retail locations. And here I can again filter this. If I take a look at these grocery retail locations, and let's look at this area down here to the west of Kensington, and you'll notice that it's mostly limited service supermarkets. Again, I can click on this and it's the M&R Food Market. If I click on this link, this is the Family Dollar Store. So these are going to be stores where there is not necessarily access to healthy, fresh fruits and vegetables and produce, and it might be, you know, simple, fast packaged food. So keep in mind that you can take a look at grocery retail locations. You can take a look at access to farmers markets. Oops. And actually, I'm looking at this as a data layer. But we can also map those farmers markets. And Chicago's pretty lucky. But let's take a look at, I don't know, let's go down to, let's go to Nevada. If we go to Nevada, we're going to find that there is not an incredible amount of access to farmers markets in the desert, which isn't really surprising. But we can go in and we can actually map and see what's there. And once again, I could also quickly and easily pull this out and get a list of all the farmers markets in Nevada, or any state, or for the United States. So for those of you in Salt Lake City, you look pretty lucky. Lots of access to farmers markets. Additionally, you'll note that there is data related to SNAP retail locations, and then the reinvestment fund's limited supermarket access data is here as well. So you can look at an unlimited amount of data points at once, but here we have a list of the SNAP retail locations. And again, I can go in and I can pull this down by a specific area. So access to food is really one of our strengths, and we have some data that is ours and ours alone to be able to pull out and take a look at. So take a look at what's here. There's data related to fast food and takeout restaurants. There's data related to beer, wine, and liquor stores as well. So as long as we're in quality of life, there's also another sample map I wanted to show you that I cannot take credit for. But we happen to have a professor at the University of Delaware who teaches a class on environmental injustice. And he teaches a class he has this map that specifically shows information about Superfund sites and the area around Wilmington, Delaware. So let's go to Wilmington. And we have a wonderful video on our website that you can review this. And I'm sure he's a lot more compelling than I am, but I'll do my best. We're going to go in here and let's take a look at the non-white population around Delaware. And we could even do, let's do people in poverty all. Let's do that instead. Let's really zoom in here. And you'll notice here under the quality of life, there are brownfields, and there are Superfund sites. And if you even scroll down, and this is a relatively new map boundary that we have, you can even look at the high-risk flood areas around Wilmington, even the moderate risk. And take a look at that. There are people living in poverty, over 25% of them living in poverty. Additionally, you're seeing where there are brownfields in that area and where there are Superfund sites and where they're in a flood zone. So you can imagine the public health risks if you consider this map and exactly what it shows. So really an interesting map and data sets coming together to show a compelling story. So, and I give full credit to our colleagues at the University of Delaware for that map. So, okay, so here we are, and we are here to talk a little bit about the healthcare, not a little bit, a lot of it about the healthcare data that's available on PolicyMap. And I'm going to just simply open up this tab. But before we show any sample maps, I was hoping that Eliza could share with you a little bit about what's here or what's brand new and what we're excited about.
Sure, thank you. So just a couple of notes on some of the data sets that we have that are new to PolicyMap that we've just released. One that if you follow our blog, you will have seen a recent blog post on, is the life expectancy data. This is a new data set published by the CDC, and you can see this is a really excellent indicator that gives an idea of sort of overall health, sort of wrapped up in a single number. So here you can see shows a pretty powerful picture. Let me see. Yeah, so here you can see a very powerful picture of areas of the country that have lower life expectancies, and this is data that you can zoom in to your city, and you can see a really powerful image of areas where health is suffering and people are dying younger than other areas. So that is our life expectancy data that is, again, from the CDC. We have a couple of other indicators as well. So if you're interested, for example, in understanding health in the senior population, you can look at some of these older categories to see how long people are living, how long older people are expected to live, and things like that. We have also recently loaded, again, there are a couple of blog posts on this, a lot of data related to the opioid addiction crisis that our country is facing right now. So we have information, much of this is also from the CDC, on rates of prescriptions and on the specific opioids that are killing people. So these are things that we can see. Let's see. Zoom out to state here. You can see how this varies across the country. You can see here, for example, this is the fentanyl. This is data that includes fentanyl, and you can see parts of the country that are really disproportionately affected. Again, some pretty stark looking maps here. So that's opioid use data. So all of these data points are relatively new. We also, Betsy has highlighted the limited supermarket access data. That has a whole lot of data sets associated with it, lots of different layers that can help really drive investments, and that actually do drive investments. That's why it was, that's why these were developed. You can see this is our polygon data, so you could get information on these sort of bounded areas where people have trouble reaching supermarkets, and you can see these dollar values that are meant to help target investments. So you can see really how much, in dollars, estimates of sort of missed opportunity for people to buy groceries locally. And then we have a few data updates coming. So we have, we will expect updates to our point data on pollution. So those brownfields and Superfund sites that Betsy showed you earlier. We will have updates to those within the next couple of months, and we will have updates on some of our health facility information coming as well. And so those are some things that you can watch out for.
Okay.
Betsy also mentioned our home sales. That's, housing does relate to public health as well. We will be updating some of our home sales indicators using data that we're developing in-house based on data that Zillow is providing to us. So that's another announcement to watch out for.
Right. Yeah, stay tuned for that one, but we're all very excited about that. So I'm going to go ahead, and this is a really good trick for all of you subscribers out there or future subscribers. You can always reset your map and start from where you began. And let's just even delve a little bit further into our health data and what is there. So you probably noticed when Eliza was taking a look at this vital statistics data that there is data related to life expectancy and birth and prenatal care, mortality rates, all very interesting data. I think one of the most striking things is if you do zoom in down to the city level when you're taking a look at life expectancy, you know, just even how across the city, how different life expectancy rates are, and how your zip geography really does dictate your life expectancy or your health. So if you take a look at this area here in Philadelphia, and we'll take a look at this area right around Rittenhouse Square. And if you were born on Rittenhouse Square, your life expectancy is 84.5 years old, not bad. But if I mosey on up into North Philadelphia and I'm taking a look at these areas around Girard Avenue, 72, not so great. Up here in Kensington, 71. So, you know, there's certain areas, and again, you can play with the ranges if you wanted to see exactly where these areas of concern are. It's very easy to take a look and see as you zoom in and take a look around and how your zip code really does predict your health. So, I know that's pretty depressing, but we'll keep going nonetheless. There's lots of great data here for chronic health conditions and infectious diseases. And what you'll note for some of these conditions are that there is CDC births data and there's CDC 500 cities data. Now, one thing I wanted to stress is that this is data that PolicyMap specifically estimated ourselves for small geographies. And it's about to be updated, and that's something that you should take a look at once we get all that Zillow data updated. That we'll be having updates to the CDC births data. There's also CDC 500 cities data, and that's for the 500 largest cities. That was a joint project between the Robert Wood Johnson Foundation and the CDC and Reinvestment Fund. So if I just simply go in here and click on adults reporting to have asthma, you'll notice you'll have this data right down the census tract. And it's really astounding that you can find this. And this is some of the perfect ways to use our 3-layer maps. So I'm going to go ahead and I'm going to take a look at Camden, New Jersey, right across the river from where we are. And we'll take a look at a 3-layer map. And in this case, maybe I want to take a look at people in poverty. So where are we? I'm having trouble finding that. I'll go in incomes and spending because I know where to find it there. So I'm going to take a look at all people in poverty, and you'll notice that there are sliders here. So maybe I want it to go and see where 40% of the people are living in poverty. And from here, I'm going to take a look at educational attainment because we know that that is a factor related to health. And maybe I just wanted to take a look at some high school. Again, I can use these sliders to see exactly what's there. In this case, I've found an area in Camden, some areas in Philadelphia, where there are people with some high school, no diploma. And here I can go on to health. And maybe I do want to look at information related to asthma, diabetes, depression, coronary heart disease. If I take a look at diabetes, and again, I might have created a map that's not showing much because I got a little wild with my estimates. But here, we can zoom out some of this. So we can find the hot spots. And Camden didn't work out so well for my example, but here, if I click on this area in Philadelphia, I found a census tract where 21% of the people have been diagnosed with diabetes. 18% of the people have some high school but no diploma, and 50% of the people are living in poverty. So really, the 3-layer map is a great way to go in and find hotspots, or to choose sites, or to see where there is an area of concern. So there really are endless possibilities as far as what you can look at in here. And again, I highly recommend that you, if you haven't already, download our new white paper that shows some great examples as well. So let me go back here and see. Oh, there's some really good information in our healthcare tab related to insurance. One of the, let me see, I'll go to insurance. I'm skipping around here. Is information about the healthcare insured and uninsured population, and the Medicare beneficiary and utilization population. So if I'm going to look at healthcare uninsured by income, again, I'm looking at a 3-layer map. So I can go ahead and find those areas where maybe it's 35% of the people have incomes of less than 25% and are without health insurance. And I can continue to layer on data as well. So keep in mind that that data is here related to income levels, insurance access, and also medically underserved areas. So I'm going to go ahead and just show you how you can quickly and easily pull up these medically underserved areas. And let's get out of the north, or let's go up and take a look at the Boston area. Oops, of course I need to spell that properly.
My former hometown.
Exactly, and I'm doing this for Eliza. To see those areas in and around Boston that are medically underserved areas broken out. And this again is a data set that if you click on here, it gives you the source information directly, and this is a premium subscriber data set. But you can see exactly where it's coming from, and I didn't link directly to where I should have. So apologies for that. But anyway, you can pull that up rather easily. So, and when we take a look at some of that opioid data again, this is one of the maps that Trudy and I came across last week that we thought was pretty astounding, and that is if you take a look at the opioid data and take a look at prescription rates. This is probably one of the most interesting maps I've seen in a long time. Let's do it for the entire United States. And if you zoom in, you can zoom in right in here. There's this area, you know, this area right here above Morgantown, West Virginia. There's 128 prescriptions for opioids written per 100 people. You know, you can see, you know, where there's a high rate of prescriptions being written. And that was, we thought was really interesting for this area up here in Michigan. So a way for you to zoom in and find that data, and it's really telling, I think. So that's also, well, I think we've covered a lot of this, and I wanted to make sure, and here, this is the same map I just showed you about opioid prescription rates. I'll be happy to share slides with anybody who has an interest in taking a look and seeing exactly what's here, because a lot of what I've covered is also included on my slide presentation as well. But Trudy, can you tell me, are there any questions out there?
So that's a perfect time, because one of the questions was, will your slides be available? So I said yes, and right before you showed our print capability, the other question was, can you show us how to print an image? So those are the two questions that I have seen. We'd love for anyone, if you have questions now, to ask. I see another couple. I'm interested in seeing where there is a lack of broadband access in medically underserved areas.
Okay.
And the next question is, I noticed the Virginia map does not generate any information about opioid overdose rates. Why is that?
Okay, we'll have to take a look at that closely.
And yes, this question is coming from someone who is at an institution that does subscribe to PolicyMap, because I believe the question is from Carlin, and you're at Virginia Tech, and yes, Virginia Tech does subscribe to PolicyMap. So you have access to PolicyMap today through your library. So however you access other services within the library is how you would get to PolicyMap. And as Betsy said, you can create your own ID and password within the Virginia Tech instance. So you can have the data, whatever you do for yourself, you can keep, you can upload data points. I know we didn't have a chance to go through that. Another question is, how often does the data get updated? And I know Eliza can answer that, but we update the data generally when it is available from the database provider or creator. So the American Community Survey data comes out generally, you may have to correct me, but in January. It used to take us until April to have it updated, and now we have it down to a science, and we have it available 2 weeks after the American Community Survey data is released. We have monthly employment data, and I know that my colleague who works with that data is able to update that on the exact date each month that the Bureau of Labor Statistics releases it. And I do know that some other government agencies, the Office of Controller of the Currency, comes to PolicyMap in order to view bank branch holdings rather than waiting to get it from the FDIC themselves. There's another question about, can data be exported in shapefile format for GIS analysis? I'm going to take a stab at it and then let Eliza answer. So a shapefile is an Esri terminology. You can download all of our data points or layer data, and we can walk you through, I think we actually have it on our website, how to join it to create your shapefile. So it's not difficult. And we do have several institutions that absolutely love PolicyMap for that reason. They're like, we have a little bit more complex mapping that we want to be able to do, or we just want to, and so they download the data to PolicyMap because, as I heard a professor explain it yesterday, it's already curated and it can be used easily. You know, when you come to PolicyMap, you're getting clean data. So that was, let's see. Interested in learning more about distance to fast food restaurants. Is it possible to do something like this on PolicyMap?
Yes. Well, there is an indicator that shows the amount of limited service restaurants per people, so the rate, but the distance I don't believe is there. Am I correct?
No, that's not something that I think that we have available currently.
So this is actually just showing the rate or the number or percent, and it's down to the zip code level. So if I go in, let me go take a look at Detroit. So I can see that down to the zip code level.
Yes, so that's going to give you an idea of the density of those kinds of restaurants in those neighborhoods. So that could get at some of the questions that you may be thinking of. Is this an area where access to fast food is extremely easy? Is it an area that's also experiencing poor health outcomes that may be related to fast food or poor nutrition? That would be a good indicator to use for that, for a question like that.
Right. One thing that you should note is that our subscribers do have access to our data team. So if you have questions about the data, how it's collected, you know, how to get at something that you're not quite sure how to get at, we can always refer your questions to them. If there's a specific data set that you're interested in, we're probably interested in it as well. So please keep your comments coming. We'd love to hear that.
Someone else has asked about the opioid question because they're interested. They're dealing with it in Wisconsin, so Wisconsin and Virginia. And Eliza, if you can answer that now, that would be great. And if you can't, I know that we can get back to you all with the answers.
Sure, I'll take over the computer, so I'm going to be driving for a minute here. All right, so the question was specifically, there were areas that had no posted data for opioid overdose, is that correct?
Yes, that was yes.
So let's take a look. I think I know the answer, but I just want to make sure. So what you'll see here, for example, this is at the Zoom level where PolicyMap was guessing that you might be interested in county level. So what you're seeing here is areas that are densely populated, like around Detroit, around, you can see the whole of the East Coast here, very densely populated. What that means is that for privacy reasons, this data is published and is available. So that's the CDC has particular rules about when, if the number of people who are overdosing or that they have recorded as overdosing from opioids is too low, they're not going to release the data there. So I'm guessing that that's what we're looking at. So here you can see it looks like no counties, and there are only a couple of counties in Virginia, mostly in the Northern Virginia, DC area that are large enough that are having higher rates of overdose that are specific to opioids. So that could be part of it. So what you'll see is that if you zoom out a bit and you switch over to states, you do see at the state level, you can look up, okay, for Virginia as a whole, what is the rate of opioid overdose deaths that we're looking at. Another tricky thing that we have found in Philadelphia with the overdose data while we were digging into it, and there is a blog post on this that you can see on this, and now I'm trying to do two things at once, type and speak, so let's see if I can. All right, so for Philadelphia, and this is probably true of a couple of other cities as well, so this is something to watch out for if you're going really doing a deep dive into looking at opioid addiction in your community. You can see that we have county level data. It looks like the rate of opioid overdose is very, very low in the city of Philadelphia. This is not the case. This is what the CDC has as recorded specifically opioid-related deaths. However, what you'll see, and then this is something that we noticed and we decided to provide some context information here. You can see we've provided unspecified drugs, which will include, could include opioids, deaths from opioids, that just basically the death certificate doesn't specifically say if the overdose was from opioids or not. And here we can take a look at this and we can see, okay, well that's, likely that the death certificates in Philadelphia for whatever reason aren't getting classified as opioid deaths when likely there are a lot of there is a pretty high rate in the city. And so we provide, that's something that we noticed, and so because of that quirk in the data, we released some additional data sets to make sure that people have the context that they need to get the whole picture, and we wrote about it in our blog.
I think there's a link directly to it from here.
Oh, look at that.
So here is...
There are a few different...
There are some links to our blog postings, and there's some really good information about how, again, this data set was collected and some of the complications that come from collecting that data.
So I hope that answered the question. I suspect that where you're seeing areas of no data, you're looking at areas where the CDC suppressed that data for privacy reasons.
Okay. Well, it looks like Trudy.
The last follow-up was just, you can say that there are a lot of overdose deaths, but from non-opioids. So I think Eliza, you answered that. And again, if you link to the blog, I know that Lauren, who put this data set together, really goes into detail about it as
Right.
well.
Well, we actually have run over, Trudy, but
I'm so sorry, because there's one other thing I just wanted to mention.
You should.
I see that there's still about 30 or more people on. So we do have a community health report that we put together with talking to organizations that needed to do community health needs assessments. And we didn't really get a chance to go through that today. Right now, it is at a county level, and I know we had pulled an example from Hinds County, I think, in Mississippi. So I just want you to know it's there, and we're about to actually improve it, even though it's only been released this year. We're already bringing improvements to it. So just wanted to point that out. So I apologize. I know, as Betsy said, we are over, but we really, really appreciate your joining us. And we look forward to hearing any questions you may have after you get back to your work. And we're, I guess that's about it for me. Thanks.
Thank you so much, everyone. We really appreciate your time this afternoon. I hope you found it useful, and we hope to hear from you. Take care.